Welcome back. With the back-to-school season underway, it is time to take an important look at your child's eye health. Now, over the summer break, kids have been spending more hours using computers and other digital devices, which can be taxing on their eyes. It can also increase the likelihood of nearsightedness and other issues. Well, here with us now is Dr. Ron Benner, president of the American Optometric Association. Dr. Benner, thanks so much for speaking with us today.
Thanks for having me today, Evan.
Our pleasure. So some reports show teens and preteens spend between 5.5 to over 8 hours looking at screens. How does this impact their eye health?
You know, we're doing a lot of studies and research right now on the digital devices, but since the pandemic, that screen time has increased dramatically. What we can tell parents to do is to practice good hygiene when you're on those devices, meaning practice our 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds, allowing the muscles in the eyes to relax, the focusing system to relax just for a few moments before returning back to the screen. We'd also encourage parents to help their children get off those digital devices. Recent studies have shown that if we can get children outside for 2+ hours a day, we see a lower incidence of myopia and a lower progression of myopia rates. So that's important over a child's developmental years.
Now, will you talk about the impact poor eye health can have on childhood development and learning?
Sure. The American Optometric Association believes that eye health and vision disorders can greatly affect a child's school performance. 80% of learning comes through the visual system. And when there's defects in that system, not only does it affect academic performance in the classroom, it can also affect athletic engagement, social interactions, and even a child's self-esteem. Unfortunately, most children don't know how to express that or even what normal is. So we encourage parents to get their children into their local doctor of optometry for that annual in-person comprehensive exam. Develop that relationship so we can talk about the child's normal development and help them succeed in the classroom.
All right, so you just hit on actually a couple things I want to ask. I was going to ask you how often should students or even adults have our eyes checked, and you just said annually, but you mentioned a phrase, comprehensive exam. And I know we hear about a comprehensive eye exam and vision screenings, and I thought that these were the same, but I understand they're different. Can you elaborate on that?
Sure. A vision screening is not a substitute for a comprehensive exam. Vision screenings will test what one eye can see at a distance of maybe 20 feet or so. That information is only about 4% of the information that we collect during that comprehensive exam. So we strongly encourage children to have that annual comprehensive exam where we're testing tracking, teaming, binocularity, focusing function, as well as the eye health of the eye. Your local optometrist can find 270 diseases in the body just through that eye exam. So we believe that this is imperative for children to have that annual exam to help keep them healthy and successful in school.
All right, so for parents who want to learn more about eye health, where can they go?
Strongly encourage you to go to AOA's Doctor Locator, easily found at aoa.org/I deserve more. On there, they'll be able to find a local optometrist to get their child in for that annual comprehensive exam and really help those children be successful during their school year.
All right, Dr. Benner, I think we have a couple more seconds left here, so I'm going to kind of get you a question I didn't really prepare you for. Let's see what you say. When I was a kid, I was always told by my parents to eat my carrots because that would help my eyes get better. Is that true?
Well, surprisingly, carrots are high in what is called beta-carotene or carotenoids. And we now know that as we age, we have macular disorders, macular degeneration, in which carotenoids are very important. So your grandparents are right. Eating your carrots is very good for you.
Wow, all this time I thought they just wanted me to eat my vegetables, but it's good to know that it actually helps. Dr. Ron Benner, president of the American Optometric Association, thank you so much for joining us this afternoon.
Thanks for having me, Evan.